Hello students, I am Dr. Swathisha, Assistant Professor from Department of Conservative Dentistry and Endodontics from Vinayaka Mission Sankaracharya Dental College and Hospitals. Today I will be presenting on the topic Resin-Dentin interface. I will be going through the following contents: introduction, history to various bonding agents and the newer advancements, components of bonding system, classification of bonding agents and the mechanism of addition to dentin, and then about the hybrid layer, which is otherwise called as a resin-dentin interdiffusion zone, factors affecting the durability of the hybrid layer, nano leakage and micro leakage, and the recent strategies that are adopted for inhibition of degradation of the hybrid layer, either by increasing the bond strength and decreasing the resin-dentin degradation, and then the conclusion. So in our day-to-day clinical practice, we would have encountered a number of cases where patients might come back with broken restoration or marginal staining of the restoration, or even in cases where the patient comes back with pain because of recurrent caries. So these all occur because of the failed restorations. So the major cause for this restorative failure is because the durability of the bond between the dentin and the resin becomes weak as days goes. So initially the bond strength achieved might be strong, but later on as days goes on, the durability comes down. There are so many reasons that is responsible for the degradation of this resin-dentin interface. So in this presentation I will be covering about the mechanism of the dentin bonding and the factors that affects the degradation of the hybrid layer and the various recent strategies that is adopted to overcome the failure of the resin-dentin interface bond strength. So literature states that replacing the failed restoration accounts for 50 to 70% of all the operative work. So this is because of the weak resin tooth interface, which leads to failure of adhesive restoration. This ultimately leads to either replacement of the restoration or even it might require root canal treatment. So strong and durable adhesion is a key factor for restorative longevity. So before going into the chapter, let us discuss a little about the history. So prior to middle of the 20th century, the major choice of material for restoration was amalgam. So for amalgam, the retention was majorly dependent on the mechanical retention, which was achieved from the cavity design, where the concept was for extension for prevention to prevent the recurrent caries, as well as for the mechanical retention which influences the durability of restoration. But with the advent of minimally invasive dentistry as well as by the invention of acid etching, we have entered into the era of adhesive dentistry. Here the preparation is very minimal and the adhesion, that is the durability of bond, is majorly dependent on the micromechanical retention. Nakabayashi coined the term hybrid layer, which is otherwise called as the resin-dentin interdiffusion zone. So from then on, several generations of bonding agents came into existence. We will be discussing about all the bonding agents in the later slides. Sano et al. Noticed nano leakage, which led to hybrid layer degradation. So in order to improve the bonding to the dentin, newer bonding techniques were adopted which slightly deviated from the conventional bonding technique. So this was given by Kanka, that is a wet bonding concept which improved the properties of hybrid layer. So as you all know, the major components of bonding systems are four components are that is the etchant, primer or the solvent, resin monomer, and the initiators, inhibitors and fillers. So among these, the etchant, primers and the resin monomers influence the durability of the hybrid layer that is formed. So literature states that bonding of the resin to the enamel is quite sufficient for a durable bond strength, because the acid conditioning has got an effect on enamel such that it causes a durable bond. But when it comes to dentin, because of the properties of dentin and because of the higher inorganic content that is present in the dentin, the bonding to the dentin becomes challenging. So let us see how the mechanism of bonding takes place in dentin. So initially the acid washing or rinsing removes the hybrid layer, and apart from that it also removes the hydroxyapatite crystals that is present around the collagen fibrils. So and then once the conditioning is done, what we do is we rinse and dry the dentinal surface. So once we rinse, what happens is the collagen shrinks and collapses. So to avoid this and to cause rehydration of the collagen, we apply the primer which comes along with the solvent. So this primer causes rehydration of the collagen and swelling of the collagen. So why we need this? So once the rehydration happens, when the monomer penetrates, it causes a nick for the penetration and proper infiltration of the resin monomer into the collagen fibrils. So why this has to be present is that this causes a monomer polymerization and collagen entanglement. So this is helpful to achieve a proper hybrid layer. So this forms ultimately the resin-dentin interface. So in resin-dentin interface, you have got two zones, that is the resin-dentin interdiffusion zone and the resin tags. So this resin-dentin interface, otherwise called as a hybrid layer, plays a major and important role in the durability of restoration. So what is a hybrid layer? Hybrid layer, otherwise called as the resin-dentin interdiffusion zone, is an interpenetrating network of polymer and dentinal collagen together with numerous micromechanical interlocks with high cohesive strength. This high cohesive strength is achieved initially when the bonding protocols are followed and when the restoration is placed. But over a period of time, there is degradation of this hybrid layer. So there are three zones of hybrid layer. The top zone contains the adhesive resin which fills the interfibrillary space. The middle zone contains the collagen fibrils infiltrated, and the bottom zone contains the hydroxyapatite crystals enveloped by the adhesive resin. So this three zones. So this is the top zone and this middle and this is the bottom zone. So as I told earlier, the components influence the hybrid layer. So the first component is the etchant or the conditioner, which is quite normally used in the pH in the range of 1 to 2. The most commonly used etchant is 37% phosphoric acid. As I told earlier, this 37% phosphoric acid itself gives a very good bond strength to enamel. But when it comes to dentin, when the etchant is applied, there are several changes that occur within the dentin and the collagen fibrils and the water content that is present in dentin that compromises the penetration of the resin monomer into the dentinal surface. So what is the major function of etchant is that it removes the smear layer and it dissolves the mineral phase, and this causes the exposure of the collagen network. So when it comes to enamel or dentin, ultimately what happens is it causes the micromechanical retention. And the next component is the primer. So as I told earlier, why we use a primer is that it causes rehydration and swelling of collagen, so that it helps in cross-linking of collagen with the resin monomer that comes in after the application of primer. So most commonly used primers are hydrophilic monomers because the dentin is hydrophilic. So the hydrophilic monomer most commonly used is HEMA, which is dissolved in solvents such as acetone, ethanol or water. So in case of self-etch primers, we have the acidic component within the primer that is used. So as the acidic content of the monomer in HEMA base increases, the pH decreases. Why I am telling is because this decrease in pH has got significant effect in the hybrid layer formation. And the third component is the adhesive. So this adhesive plays an important role in the formation of hybrid layer as well as the formation of resin tags. So the adhesive requires to be hydrophobic as well as hydrophilic. Thus the adhesive contains hydrophobic component. This hydrophobic component is majorly to prevent the hydrolytic degradation of the hybrid layer that is formed, because if the resin is going to be more hydrophilic, it causes water sorption, which ultimately causes degradation of the hybrid layer. For this reason, the resin has to be hydrophobic. And one more reason is that it has to be hydrophobic so that it gets adhered to the composite resin that is going to be placed, and it has to be also hydrophilic because only if it is hydrophilic it can diffuse into deeper layers of the collagen fibrils and form a proper resin tags into the dentin. So the hydrophobic component is bis-GMA, TEC-DMA and urethane dimethacrylates, and the hydrophilic component used majorly is HEMA. So Van Meerbeke in 2013 put up this classification or generations from 4th to 7th generation. So 4th and 5th generation constitutes the etch and rinse adhesives. In 4th generation, there are 3 steps to be followed. In 4th as well as in 5th generation, a separate etching or conditioning step is done. So it is said that the separate conditioning step is required for proper bonding of the resin to the enamel. So most commonly this total etch technique or the etch and rinse technique is more supportive for bonding to the enamel. Okay, so 4th generation has got a separate conditioner, primer and the adhesive resin, but the 5th generation combines both primer and the adhesive resin, but still it has got a separate etching step. When it comes to 6th and 7th generation, they constitute self-etch adhesives. In 6th and 7th generation, there is no separate etching step that is used. So in 6th generation, it is a 2-bottle system where etchant and primer is combined. As I told earlier, in self-etch primer, what is done is the acidic content or the acidic monomer is incorporated in the normal primer, and adhesive resin is used as a separate step. In 7th generation, it is a 1-step technique where all 3 components are present in a single bottle. The 6th and 7th generation is more useful in bonding to dentin, is more good when self-etch adhesives are used. So apart from this, later on universal adhesive came into existence, and the major component of universal adhesive is 10 MDP. One significance of the universal adhesive is that it can be used both in total etch as well as a self etch technique. So say you have to bond to both enamel as well as dentin. So this one bonding system is enough to apply on both the enamel as well as dentin. On enamel it can be used as etch and rinse, and in dentin it can be used in self-etching mode. So that is the significance of universal adhesive, and its mechanism is quite different from other bonding agent, where this bonds ionically to the hydroxyapatite through a process called as nano layering. So this is hypothesized that it can cause a more durable hybrid layer. So let us compare and see how the resin dentin interface is in an etch and rinse as well as in case of self-etch adhesives. So in this etch and rinse technique, what happens is the smear layer which is present is removed once conditioning is done, and there is a step called as rinsing and drying. So with rinsing and drying, the smear layer is completely removed, and you can see here that the collagen fibrils and the tubule is exposed here. So next what happens is, with the application of the adhesive, there is formation of hybrid layer, and you can notice that still here there is a space which is not completely penetrated by the resin. This occurs because there is a difference in depth of conditioning of the etchant and in the depth of penetration of the resin. So what happens is, this leaves this space empty, again compromising the strength of hybrid layer. And the next technique is the self-etch adhesive. So how does self-etch adhesives works? This doesn't completely remove the smear layer. This just modifies the smear layer because the etchant and primer is combined, and or all 3 steps are combined together. So when the etchant and primer is combined, there is no separate step of rinsing. So it is just combined, and the smear layer that is present is just modified and incorporated into the hybrid layer. So here you will have formation of hybrid layer where there is a resin, the smears plug as well as the collagen fibrils entangled. So this is the difference between the hybrid layer that is formed within the total etch and the self-etch adhesives. So now so far we have discussed on the mechanism of formation of hybrid layer and how it is formed in total etch technique and how it is formed in self-etch technique. So now let us see how this hybrid layer degrades over a period of time. So it is not a single factor that influences the degradation of hybrid layer. There are several factors that come into existence when it is a question of durability of hybrid layer. So the first and foremost factor is the degradation of the adhesive resin itself. I had told you earlier that the adhesive resin consists of hydrophilic as well as the hydrophobic component. So this hydrophilic component ultimately causes the aqueous sorption, and that weakens the hybrid layer. And one more thing is that this hydrophilic particles reach to the bottom of the resin tags, whereas the hydrophobic component of the adhesive resin stays at the top layer. The camphoroquinone, which is a photosensitizer, being hydrophobic, it stays in the top without getting penetrated or impregnated deep within the collagen fibrils. So what happens is there is incomplete polymerization of the resin that occurs at the bottom layer. So this ultimately over a period of time causes the hybrid layer degradation. And the next factor is incomplete infiltration of the adhesive in the exposed collagen network. As in previous picture, I had shown you that there is difference between the depth of conditioning and the depth of penetration of the resin monomer. The depth of conditioning is more, that is the depth of demineralization is more, leaving more of exposed collagen, whereas the resin doesn't have the capacity to infiltrate to such depth that it completely entangles the collagen fibrils. So what happens ultimately is that the collagen fibrils remain exposed at the bottom. So this exposed collagen is more vulnerable for the degradation of the hybrid layer. So what are the factors? Incomplete hybridization of the exposed collagen, inability of resin monomers to replace both the free and collagen bound water. Definitely there is more of water deep within the collagen fibrils which has not completely been able to be replaced. So that ultimately hinders the penetration of your hydrophilic monomer. And then highly hydrated proteoglycan hydrogels are said to be found in the interfibrillary space. So these highly hydrated proteoglycan hydrogels, what they do is they act as filters where they allow only low molecular weight monomers to penetrate deeper, and they let the high molecular weight monomers to stay at the top. So bis GMA, being a high molecular weight monomer, stays at the top and only the low molecular weight monomers penetrates deep. So ultimately what happens is there is a reduced strength of hybrid layer that is formed because of only low molecular weight resin monomers that is being penetrated deeper. So this also leads to failure of the hybrid layer. And then the third and most important factor is the degradation of collagen by the endopeptidases. So I told that the collagen is not completely encapsulated by the resin that is infiltrated. So ultimately the collagen is exposed, and the acid that enters when conditioning causes the activation of the fossilized endopeptidase proteases as well as the cysteine cathepsins. So these proteases and cysteine cathepsins remain fossilized within the dentin. So once the conditioning is done, it causes the exposure of these to the external environment, which further causes the degradation of the exposed collagen network. So what are the triggering factors for these? One is by proteases, other MMPs, reactive oxygen, and physical agents such as low pH and heat. So to put it in a nutshell, the hybrid layer degradation majorly happens because there is unprotected collagen, which causes the activation of matrix metalloproteinases and cysteine cathepsins, which causes the hydrolysis of the organic matrix of demineralized dentin. So what are the effects of this degradation? One and major consequence is of nano leakage. Micro leakage occurs majorly at the interface, and the causes for micro leakage is different from that of nano leakage. Micro leakage majorly happens because of polymerization, shrinkage and other factors which causes discoloration and recurrent caries. But this nano leakage majorly occurs within the hybrid layer because of all the previous factors that we had discussed. So this also ultimately leads to restorative failure. So nano leakage is nano-sized channels within the hybrid layer that has not been fully penetrated by resin, causing degradation of the dentin bond. So as of now, we have seen the mechanism and the factors that influence the degradation of hybrid layer. So now let us see how to achieve durable hybrid layer. So there are various research going on to achieve a durable hybrid layer. So there are a few mechanisms based on which the research is going on. The first is by inhibition of matrix metalloproteinases. So by inhibiting the effect of matrix metalloproteinases on collagen, there can be there can be prevention of degradation of hybrid layer. And the next is by collagen cross-linking. So this exposed collagen, when it becomes cross-linked, it prevents a further attack by the matrix metalloproteinases. And the third one is where the denuded collagen is to be completely protected with the resin. So this is very questionable, because again the water content that is present in the dentin is not replaceable completely. So what are the resin bonding strategies to overcome the resin dentin degradation? One is the use of collagen cross-linkers, antioxidants, protease inhibitors, and by reinforcing the resin matrix with remineralizing agent. This is an attempt to cause a regeneration within the interface so that it causes a more strong and durable hybrid layer. And resin matrix that is reinforced with organic fillers, and also by modifying the bonding technique if there can be an improvement in the durability of hybrid layer. So how does collagen cross-linkers work? The stable covalent cross-links produced with external cross-linkers reduce the molecular mobility of the active site, which inactivates the active site for dentin proteases. So this is a non-enzymatic and it improves the mechanical properties also. So what are all the various collagen cross-linkers? One is a physical agent, that is especially vitamin B2, when activated by UV light, induces the formation of covalent bonds mediated by the oxygen singlets between the amino group of glycine of collagen chain and the carbonyl group of proline and hydroxyproline of side chains, leading to a cross-linking effect of collagen. So collagen, when it remains in its triple helix structure, it is more durable and strong. So this collagen cross-linking plays a similar role. And the synthetic agents that are used as collagen cross-linkers are glutaraldehyde, chlorhexidine, proanthocyanidins, grapeseed extract, carbodamide. The natural agents are bromelain, methacrylate modified chitosan, and ascorbic acid. Though all these materials are under study, it improves the mechanical properties, but the question is its longer application time and the risk of staining of the tooth with application of many of these products. The next strategy is by enzyme inhibition. So one majorly studied product under this is a chlorhexidine. So chlorhexidine is used in concentrations of 0 to 2%. 0.2 to 2%. So it binds to the zinc of catalytic domain of MMPs and it prevents its hydrolytic activity. Here what happens is the major focus is on preventing the MMPs from attacking the collagen. So chlorhexidine inhibits effectively MMP2, 9 and 8 and cysteine cathepsins. So the effect of applying the chlorhexidine, initially it is good, but over a period of time in 2 years it is reduced drastically. So other enzyme inhibitors that is used are again carbodamides. It covalently bonds to matrix metalloproteinases, and you have got polyphenols that exhibit similar properties, that is proanthocyanidins, genipin, epigalactin, and then benzalkonium chloride. Quaternary ammonium compounds are also used for the purpose of inhibiting MMPs. Other synthetic MMP inhibitors are tetracycline, doxycycline and bisphosphonates. So antioxidants also prevent the free radical formation, which is said to improve the durability of the hybrid layer. So the various antioxidants used are proanthocyanidins, noni fruit juice, axle, vitamin C, vitamin E, quercetin. All these are under experimental stages where 1 or 2 studies exist, but these are all the various materials that's been in research in order to improve the hybrid layer durability. And the next strategy is resin matrix reinforcement with fillers or remineralizing agents. So the major aim by using the remineralizing agent is that to prevent the chemical degradation by reinforcing the dental adhesives. So the most commonly used remineralizing agents are carboxylic acid functionalized titanium oxide, copper, silver, zinc oxide and zirconia nanoparticles. So this improves the mechanical properties and thus decreases the hydrolytic degradation. Here we are not going to prevent the degradation with the help of either preventing the enzymatic degradation or by preventing the exposure of collagen, but instead whatever is formed, we are trying to retain it by improving the mechanical strength of the hybrid layer that is formed. And then similarly biomimetic remineralization, where bioactive silicates such as calcium, sodium phosphosilicate have been combined with hydrophilic biodegradable polymers, and fluoride containing adhesives are also being in research so that it promotes remineralization of the adhesive layer. So here what is expected is hybrid layer remineralization. One more technique is by altering the conventional bonding technique that I had discussed earlier. So one reason for the bond failure is that the water that is present within the dentin prevents the complete infiltration of the monomer into the tubules as well as into the collagen. So what was advocated is that the ethanol wet bonding technique. Here the residual water is replaced by the ethanol, which allows a better penetration of the resin monomer in the collagen network, and it avoids the separation in nanophases of the adhesive. What are these nanophases is that when hydrophobic and hydrophilic component is combined as a single component when applying, so that the hydrophilic component goes deeper and the hydrophobic component is present on the superficial layer. So all these when present in single bottle may cause nanophase separation. Ultimately that also leads to bond failure. So in order to avoid that, this ethanol wet bonding concept was introduced, and it also is said that it partially inhibits the activity of MMP. And one more technique is that the use of mild self-etch adhesives. I had told you earlier that acid etching causes a deeper demineralization where the resin penetration cannot reach to that depth. Understood? So in such cases, when you use a mild self-etch adhesives, the conditioning is caused to a lesser depth compared to that of conventional conditioners that is used. So when the conditioner reaches to a lesser depth, the collagen that is exposed will also be less. Ultimately its degradation also can be prevented. So what are the different mild self-etch adhesives that are used are 10-MDP, 4-MET and 2-phenyl-P. So this forms thin hybrid layer, it minimizes a nano leakage, and it leaves a substantial amount of hydroxyapatite around the collagen fibrils to mask the collagen. Thus it keeps the enzymes fossilized within the dentin. And one more technique is deproteinization. Here a reverse hybrid layer is formed. What was believed was that this collagen, when it is present, only the water content is increased and the penetration of the resin becomes challenging into the collagen fibers. So this was an attempt made where deproteinization was carried out, where the collagen was completely destroyed by application of sodium hypochlorite. So this led to formation of reverse hybrid layer. So the mechanism of resin bonding to hypochlorite treated dentin. Here the etched dentin was treated with hypochlorite, producing an unusual type of resin infiltration of mineralized dentin that was called a reverse hybrid layer. So to summarize, these are all the different strategies that is being employed to achieve a durable hybrid layer. However, all these strategies still remains under research, and still we don't have a proper improved strategy which can improve the durability of hybrid layer. So I had spoken about all the techniques that's been mentioned here, but not spoken about the laser treatment. So laser treatment is also believed to improve the bond strength, where it has got the capacity to remove the smear layer and causes the infiltration of resin, but still even it is not as significant as that is caused by the acid etching. So to conclude, regarding future prospects, there is a fairly new proof of concept strategy introduced to dentistry that proposes the idea of dental tissue regeneration. It is called as biomimetic remineralization. The use of novel nanoparticles or compounds at the atomic level would be important for endowing the adhesives with highly bioactive properties. Thank you for watching.